It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best physicians in all of the Houston area that are helping to change people's lives.
And some of the best physicians includes our first doctor, one of the best radiologists, of course, in the entire Houston area. It's Dr. Stephen Rose.
Breast cancer is a field of many specialties. I cannot do everything myself. There's the imaging and the diagnosis of cancer, and then of course the surgical part. And so not one person can take care of breast cancer by themselves.
So here at Memorial Hermann Breast Center at Southwest Campus, we really try to approach all aspects of patient care. We try to get the patient through all different disciplines, and we work as a team to do a whole approach to cancer therapy.
Dr. Rose and I met in 2000. I had been in practice for a year, and he was brought on here to develop a breast center. And up until then, it was just a general radiologist who was reading x-rays. And Dr. Rose was very different because that's all he did, was specialize in breast imaging. And as I was specialized in breast surgery, it was an immediate fit.
So it was a very awesome opportunity to work, to collaborate with people who had tremendous experience, large experience in breast surgery and breast cancer, as well as in handling benign breast disease. And it's really very satisfying to work as a team, the surgeons and the radiologists, as well as the oncologists and radiation therapists, working closely together to give the patient the very best care that they can get.
Well, breast cancer has always been an important part of my life. My first experience was back when I was very young, and my mother had breast cancer. She died when I was 13 years old. And so it's always been a part of my life, something that has been important to me. Just like Dr. Rose specializes in mammography and breast imaging, I specialize in surgery for the breast. I'm focused 100% on taking care of breast cancer patients. And that dedication and that focus really drives the quality of the surgery, and it drives the quality of the outcomes as well.
12-year-old Kyle loves to play baseball, but it was hard to do due to allergies. That is until he met Dr. Lynn Dickens. To find out more about Kyle's story and other life-changing stories, log on to bestdocsnetwork.com.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." made an appointment for me with Dr. Barghese, and when she examined me, she said, just stay right there. You're going to the hospital.
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory, found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Barghese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
As always, for more information on any of the fine doctors you've seen on today's show, please visit our website. It's bestdocsnetwork.com. Now let's check in with our next best doctor. It's gynecologist Dr. Imtiaz.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within just that day. I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine. I
think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
Let's talk about vitamins. There is a lot of misinformation. In the past few years, the studies show us that multivitamins in general don't do the good that we thought they did. It's better to get the vitamins from your food. So multivitamins won't really hurt you, but they probably won't help you. Your mom was right when she told you, hey, anything that you eat that's fruits and vegetables is going to be good for you, especially if they are green or orange. That's where you're going to get the best vitamins that are going to do you the most good. Now, vitamin E can hurt you. It's best not to take more than 200 units of vitamin E. Vitamin D can help you. It's a vitamin that's involved in your immune system, and it helps reduce heart attacks and strokes as you grow older. So you ought to have your vitamin D checked, and if it's low, start taking vitamin D from over-the-counter sources. As far as women in childbearing ages, I think folic acid is good. Mega doses are bad. You don't want to do mega doses of any vitamins. That's where you get into trouble. So avoid that kind of advice that you'll see in the press and on the internet.
Janice was experiencing a lot of problems with her sinuses until she met Dr. C.T. Nguyen. To hear more about Janice's story and hear other life-changing stories, log on to bestdocsnetwork.com.
Every woman is, a little bit different on one side than the other, but after I got pregnant and I had my daughter, I was breastfeeding her, and she would only take from one side, which was my left side. I guess because of that, it made that side so much smaller.
Mandy came to us initially asking for breast augmentation, and after doing an exam and taking photos, it became obvious that she had a really big discrepancy between her breasts. And after further questioning, she told us that she had to wear 2 bras and was putting something on the other side to balance it out, and there was a large difference. And it was a confidence issue, it was a clothes issue, it was being able to get into a wedding dress that fit issue, and so there was a lot more going on than just a simple breast augmentation.
Probably an A cup, maybe a small B on the left side, and then on the right side I was like a full C. And so there was a huge difference there, and I didn't feel comfortable looking at myself in the mirror. I couldn't find bras to fit.
And I said, I'm here to make you happy. I'm going to take care of you, and we're going to do everything we can to make you happy. And she did indeed need a lift. We put in different size implants to account for the different sized pre-existing breasts.
The hospital staff was wonderful. He was wonderful. He made me feel completely comfortable, explained to me, exactly what we were going to do and what was going to happen. And
it's not just about the size of the breast, but it's the confidence and the balance, that she's no longer thinking that people are looking at her and noticing that she has 2 sports bras on, or noticing when she goes out and is doing something that her breasts are uneven.
I'm getting married on Friday, and I had, there's healing and, all this process you have to go through, and I wanted to be completely healed. I wanted to have no pain, and everything like that. So that's why I chose to do it a few months in advance.
Everybody has subtle differences, but some people have more than subtle differences, and that's where a procedure like this is perfect, where it can correct those differences and really help people have confidence and self-esteem to know that they are filling their clothing out that's designed in a certain way.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Dorothy, she had multiple teeth that were decayed, and she had failing restoration. So she had a history of having multiple dental procedures on her natural teeth, and these restorations had subsequently failed over time, secondary to wear as well as decay.
I came to see Dr. Metz, and I was, of course, just knocked out. My heart went, he was so nice and encouraging. He said, yes, I think we can help you.
At 90 years old, she had all her lower teeth removed and placement of 4 dental implants, and also placement of an immediate prototype, so to speak. So she had fixed teeth on the day that her teeth were removed.
Right, I had no problem whatsoever. It worked. I could eat and chew, and I looked normal. And I was just perfectly happy with it.
Her situation is not unique. There's many people in her age group that just by virtue of their age, their teeth are beginning to fail. Many of them are under the misconception that they're too old to have oral surgery safely. Although by virtue of their age, that age bracket, we do more implants in that age bracket than any other age bracket. So they do tremendously well with it, just like somebody much younger. And also their health improves afterwards.
And I just was thrilled. That first steak was like out of heaven. It was paradise. You know, it was just wonderful. I was so thrilled and happy.
You know, with their fixed teeth, they're able to chew what they want and not foods that are high in sugar. And so they're healthier in the long run. For one, they're not fighting infected teeth. They have a healthier state in their mouth and they're able to chew what they want. And they're able to have a much more balanced diet.
I would say, don't do that. Don't tough it out. Go get something done. Go get some dental implants and be comfortable like I am.
When you ask these individuals after they've had this procedure done, they say they feel more energetic. They just feel better. And then we feel that it's their body not fighting a chronic infection, that they're in a healthier state overall.
Don't forget, for more information on all the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com, bestdocsnetwork.com, featuring some of the best doctors in the entire Houston area.
And our next best doctor, it's podiatrist, Dr. Gabriel Maislos.
Many presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe, where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, you know, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think like probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, you know, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of, you know, surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, you know, no pain, you know, it just felt better. And I was so happy, you know, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, you know, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and the next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone.
I mean, it's not sore or nothing, it just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. You know, a lot of people are concerned that they've heard from, you know, their neighbor, or they know someone at work who's had the surgery, and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really, 2 weeks of just not putting weight on it, and you know, we've really come a long way with our surgeries.
I started having heavier periods where I would have to, you know, make sure that I was near a restroom, and, you know, kind of got to be about every hour to 2 hours, I would have to check, have excessive bleeding, and so I would not, you know, wear anything that would, you know, have the ability to, you know, show any type of accident, which again is very embarrassing.
It's a very common problem. It affects about 1 in 5 women. A lot of women think they just have to put up with it, and that's part of being female, and sooner or later it will stop. But in fact, it goes on for a long time, and it interferes with their work life, their exercise life, their sex life.
And it started getting irregular too. It wouldn't always be every 4 weeks. I mean, sometimes I would have it 3 weeks, sometimes 5 weeks, so I couldn't even anticipate if we were going on a trip or, you know.
Again, in the old days, 10, 15 years ago, it was very common for the gynecologist to say, well, let's just do a hysterectomy. This new minimally invasive technology was developed called endometrial ablation, referring to ablating or removing the lining of the uterus.
And Dr. Leibman gave me the alternatives and said it's a very short procedure. I trust him wholeheartedly. I mean, I've known him for 20 plus years, and I would trust my life with him.
She certainly didn't want to have a hysterectomy. So when we talked about this minimally invasive procedure that involved no cutting, no hormones, she was really interested.
And so came in here, cannot stand needles, cannot stand any procedures. I was in and out of here for sure in an hour. And I mean, obviously I did get put under.
The recovery is very similar. It's going home, taking a nap, having some pain medication, and usually that night there is some cramping, but the following day almost everyone is up and about and doing what they need to do.
And went home, slept for maybe a day off and on, and I was back at work the next day. And ever since then, I've been perfect and feel wonderful.
For more information on all the outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. Right now, it's time to head to one of the best ear, nose, and throat doctors in the entire Houston area. It's Dr. C.T. Nguyen.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, we inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
I am an athlete.
I am a World Series champion.
I'm a hockey player.
I'm a football player.
I am strong.
I am strong.
I am strong.
Fight colorectal cancer. Demands a cure for colon and rectal cancer.
I'm strong because
I have lost a friend's mother.
Because I lost both of my parents to this disease.
I am strong because nobody should suffer. Let's beat this cancer.
One simple test, and you could save your life or someone you love.
Get screened. Be a part of 1 million strong.
Dr. Meredith Morgan is one of the best physicians in helping women manage menopause. Practicing for over 35 years, Dr. Morgan, as you see, has a unique office. It's located in the Museum District, a freestanding facility with a relaxed atmosphere. Today's topic, perimenopause.
It's really important to understand that this is a normal process, and it happens with all women. It starts in their mid-40s. The average age of onset is 47, and on average it lasts about 4 years.
According to Dr. Morgan, perimenopause represents a change. Women will experience a number of symptoms.
This is a time of relative estrogen deficiency and brings on mind, mood, memory, and even sleep disorders and irregularities. Yes, there are hot flashes and night sweats that most women think of as menopausal, and yes, they can be just as severe as the postmenopausal ones. But the differentiation between transitioning and a non-cycling constant state is the unpredictability and uncertainty that can be so distressing to a woman.
For women experiencing perimenopause, Dr. Morgan outlines the next step.
We have 3 levels of management. The first will be basically lifestyle adjustments and home remedies. The second is non-hormonal medical prescriptions, and the third is hormonal management. We want to treat at the lowest dose for the shortest duration, consistent with what the need is. We have to understand it's important to use what is acceptable to the woman herself. In my mind, without a doubt, we've taken a step forward for the city of Houston and its surrounding environments. We've developed a site that is comfortable and convenient, that provides medical center quality with minimizing the hassle that's involved. It's been very rewarding to have done this for the last 10 years, and I'm looking forward to the next 10 and 20 years in continuing to do and help women throughout the entire region.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
With a gastric sleeve operation, for example, he's going to lose the majority of the weight in the first year. And he should see quite a bit of benefit in terms of how his joints feel, his ability to bear weight, and the axial loading on his spine.
Before surgery is approved, Paul has to clear several tests. First, a visit with cardiologist Dr. Nasser.
So the purpose of the evaluation is make sure the heart muscle is in good shape, the valves in good shape. So from the cardiovascular standpoint, we do all this to tell Dr. Marvin, the surgeon, that your patient is in good shape and we expect no problems from the cardiovascular standpoint when he goes through surgery.
A comprehensive sleep study was then performed to properly diagnose his sleep apnea.
I wanted to offer the service for Paul because in the situation in which his weight and always has been a big person, there are some adverse effects to that, and wanted to diagnose the level of apnea that he may be experiencing so that he could get the proper treatment for whatever needs to happen. We just want to make sure that we diagnose everything and get him where he needs to be.
Paul was now cleared for the surgery that would forever change his life.
Well, good morning. I'm here. It's about 5:30 in the morning. I'm getting ready for my pre-surgery prep, which starts in just a few minutes. My surgery starts at 7:30 a.m. and I've come here. I'm fixing to meet with a doctor in just a few minutes, and I'm very excited. I'm looking forward to this day. We all make decisions where we look back on our lives and say, I'm glad I did that, and I already know in advance it's going to be one of those decisions for me. Look back on my life a few years from now and say, I'm so glad I did this, and I'll always remember this day, October the 25th, 2012, when my life got better for infinitely.
That'll do it. That'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in the entire Houston area that help change people's lives. And for more information on any of these doctors, Candace, where can the people find the doctor?
Well, of course, they need to go to our website. It's bestdocsnetwork.com. And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
All right. So long, everyone. We will see you next week.